If you suffer with sinusitis, taking the supplement Bromelain and rinsing your sinuses once or twice a day can really help. About 35 million Americans develop sinusitis each year. My wife used to be one of them. She no longer suffers with it. We'll get into that story. Sinusitis medically is inflammation and swelling of the tissue lining the sinuses in your nasal cavity. So sinusitis is usually caused by infections, but also nasal problems like a polyp or blockages or allergies. Allergies are a frequent cause. So what are your sinuses? Your sinuses help lighten the weight of your head since they are air-filled cavities. And your sinus cavities, they're made up of 4 pairs of sinuses. They help warm up the air you breathe in. They moisturize the air you breathe in. They're a chamber that help resonate your voice, so they have other activities. Importantly, your sinuses also produce mucus. Now, mucus is essential. It acts as a protective layer, but it also maintains the moisture in your nose, etc., keeping critical organs from drying out. But mucus also acts as a trap. It traps things like dust or smoke that can irritate your nose, your throat, your lungs. It also traps bacteria. The mucus contains antibodies and bacteria-killing enzymes that help fight off infections. So what are some of the symptoms of sinusitis? Well, terrible headaches. But there can also be pain accompanying that in your cheeks, because your sinuses radiate towards your cheeks, or in your mouth. Typically there's a stuffy nose. There could be a runny nose, postnasal drip, some cases a cough, loss of sense of smell. When I had my small group of pharmacies, they were called Hickey Chemists Limited, I had numerous clients that would come in repeatedly with prescriptions for sinusitis. It was like they were trapped in a revolving door. They typically were prescribed antibiotics for an infection and corticosteroid nasal sprays to decrease the inflammation. This worked, but it only worked for a short time in many of the clients. Frequently, they came back within several weeks because the infection came back or the sinusitis came back. Maybe it wasn't even caused by an infection to begin with. And they might return 2, 3, 4 times to treat sinusitis. So it just wasn't working frequently. You know, one size doesn't fit all. There are different causes for sinusitis. They need to be approached differently. So for clients with sinusitis, I always recommend rinsing the sinuses with a normal saline solution. This really helps. It's like the start of the therapy. Your blood contains a certain level of salt, sodium chloride. Normal, it's 0.9% concentration. Normal saline matches the amount of salt in your blood. This way, if you use normal saline as a nasal spray or in your eyes as an eye drop, it doesn't sting. And I'm not talking about a nasal spray. I'm not talking about nose drops. I'm actually talking about something more like a douche, something to really clean out your nostrils. And if you do that once or twice a day in each nostril, it can help tremendously. Now, bromelain is something else I frequently recommend. It's a known supplement for relieving sinusitis symptoms. Sometimes I add quercetin along with the nasal rinsing. In my experience, this has been fantastic for sinusitis. Bromelain reduces the swelling and inflammation in the sinuses. Quercetin helps with inflammation also, but it also helps if there's a component of allergies. And rinsing clears out any debris and helps clear out any microbes or blockages. So rinse with the normal saline. Take 500 milligrams of quercetin with a little bit of vitamin C in it. They work better together. Quercetin is a flavonoid. We talk about that in our episode about allergies, springtime allergies. Quercetin is a flavonoid. It's found in very good, healthy foods, but only in small quantities. And vitamin C helps it work better. So if you take quercetin 500 milligrams 3 times a day, and you take 2 or 3 bromelain capsules with each meal, and then you rinse your sinuses with the normal saline, it can really mean a lot. Okay, let's just go to a break. Jerry Hickey and Vite Health, and we'll be back and talk a little bit more about some natural remedies for sinusitis.
This This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Back in the 1980s and 1990s when I had my pharmacies, I read studies about a pineapple enzyme extract, many of the studies coming from Germany. And it confirmed that it worked. And some of the studies were on little kids who had sinusitis. It demonstrated how safe bromelain was. And then I met Ruth, the love of my life. Ruth is my wife, but when I first met her, we were friends at first. We were friends for like 6 months before we decided that we liked each other. It was just one of those things. And what happened, she was suffering terribly with sinusitis. And a couple of times she contacted me. I was living next door at the time. I was renting a house next door. And she came over and she contacted me and she goes, "I think I'm having a stroke. Get me to the emergency room." And I explained to her, a stroke comes on like thunder and lightning. It's sudden, terrible anguish. Sinusitis develops slowly over a number of hours. I said, that's how you could tell them apart. Because the pain from sinusitis, the headaches it could cause, are terrible. So I brought Ruth to, I did take her to the emergency room several times. She was checked out. I already knew she had a history of sinusitis. I said, listen, this is broken. What your doctor's doing is just not working. Let's go to a pharmacy. Let's get you a nasal rinse. I showed her a normal saline nasal rinse that you flush out your sinuses. I told her, for the first 2 or 3 days, please use it twice a day in each nostril. And then after that, if you want to try it once a day, it'll probably work after that. I said also, I want you to take this Bromelain and quercetin. I brought them home from my pharmacies. I still had the pharmacies in those days. And that was before I opened Invite Health. In any event, but the pharmacies, by the way, were nutrition-oriented pharmacies. They were fascinating pharmacies, really. But in any event, it worked. Ruth really thanked me. The other thing I told her, she had her bed against an outside wall, and it was up on a hill, so the wind, her wall was really cold, and I think that was part of the cause. So I said, move your pillow to the other side of the bed. I said, get your head away from that cold wall. And you know what? Between moving her head and using these supplements, it absolutely worked. Now it's been years since she's had sinusitis. I think in the past 15 years, she's had sinusitis, very mild, maybe one time. She rinsed her nose, she took the Bromelain, it was gone. So welcome to our sinusitis, Bromelain, and rinsing really helps episode. That's a cool name. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about how you can help alleviate sinusitis safely and naturally. Be sure, please, to subscribe to the Invite Health podcast, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information concerning today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more info. Let's get started. So what exactly is bromelain? It's an enzyme. It's found in the pineapple plant. It's found in pineapple juice, but especially in the pineapple stem. And bromelain is used frequently for reducing swelling and inflammation, especially in the nose and sinuses. It's a compound made up of a family of enzymes that are unique to pineapples, called proteases. They can be used for improving the digestion of food. Bromelain was first discovered in 1891 by a chemist named Vicente Marcano. Bromelain was described as the proteolytic ferment of pineapples. And pineapples are the only major source of bromelain. It's the only source, the pineapple plant. There are no other fruits with high content of this compound. They get it from the stem. There's more in the stem than the fruit. Plus, they sell the fruit as food. Okay, let's go to a break, and when we come back, we'll talk about how does bromelain work, what does it do for you, what can you expect, and then we'll go to some studies.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, Jerry Hickey here. Welcome back. We're talking about bromelain for sinusitis and rinsing the sinuses and what else you can do for sinusitis. That really helps. Safely helps. So how does bromelain work? We explained bromelain is an enzyme extract from the pineapple stem. Pineapples were first introduced to Southeast Asia, the Pacific Rim over there, in the 16th and 17th century. In fact, interestingly, they were the first commercial plant. Bromelain works by inhibiting prostaglandins that cause inflammation. Prostaglandins are kind of like hormones. They're these little froggy-looking chemicals in the human body that are involved with balancing the immune system, but certain prostaglandins, when they're activated, cause pain and inflammation and swelling. So bromelain works by reducing the production of prostaglandins that could cause swelling, pain, and inflammation. You can use bromelain safely for sinusitis. But because it's a mix of enzymes, it can also help with indigestion and bloating because it helps break down your food. It helps with breaking down proteins especially. So let's go to some studies. What have we learned? How much do we know? There's been a number of studies on the use of bromelain for nasal swelling and inflammation. A systematic review was performed. That's when you gather together studies and then you review the studies to see which are acceptable, and you perform something called a meta-analysis. You get similar studies that you believe are low in bias, they're well performed, they're well designed studies, they're accurately reported, and like I said, they're lacking bias, and they show that it worked. It indicates that bromelain is helpful in relieving the symptoms of acute nasal inflammation, of acute sinus inflammation, especially if you add things like quercetin and rinsing the sinuses. So here's some of the specific studies. First of all, if you swallow bromelain, it's an enzyme. So the thought process was, well, it's going to get used up in your digestive tract to digest your food. That's actually not accurate. University of Siena, Italy, the Catholic University of the Sacred Heart in Rome, and the University of Rome did studies on this. They wanted to see if you take bromelain by mouth in a capsule, will it actually get to the sinuses? The answer is yes. It has an excellent distribution in your sinuses, in your nose, in your mucous tissues. So here's the journal, Otolaryngology, Head and Neck Surgery. It's Peninsula Medical School. That's the University of Exeter and the University of Plymouth over in the UK, over in England. And they looked at 10 randomized controlled human clinical trials, and they found, hey, listen, we found evidence here that bromelain works in acute sinusitis. But it also helped chronic sinusitis. Chronic sinusitis is when it kind of hangs around, it's low grade, it keeps on coming back. It really worked. And they found that it was actually very safe, that it helped with the symptoms, and it was very safe. And here's what they said. There is encouraging evidence that bromelain is effective and adjunctive treatment in acute rhinosinusitis. Well, there you go. So here's the University of Cologne, Germany. As I mentioned before, many of the studies on bromelain have come out of Germany. This is the University of Cologne. It's patients with chronic sinusitis so before it was acute sinusitis. Some of them had nasal polyps, some didn't. It did help in the patients with sinusitis who had nasal polyps, but it worked better in the patients with sinusitis who didn't have nasal polyps. It was a 3-month-long study. And they found out that it reduced the symptoms like headache, nasal pain, runny nose, coughing, pain in the cheeks, pain in the forehead. But it also improved their quality of life. And typically they took 6 capsules a day. There was no side effects, no adverse events. As I mentioned before, the Bromelain does seem to work much better if you add quercetin with a little bit of vitamin C. Quercetin is often helpful. It's great for sinusitis, it's great for inflammation, but it's also helpful with allergies, so it covers that aspect. And rinsing your nose with a saline nasal spray. Are there any drug interactions? Yeah. If you're taking strong blood thinners, you have to be a little careful with bromelain. Bromelain's a poor blood thinner, but it can thin the blood a little bit. Is it safe? Yeah. They're using it in kids with sinusitis over in Germany. It's commonly prescribed there. It was very, very safe. So if your sinusitis is allergy driven, you may also want to listen to a different podcast I did. It's called Springtime Allergies and Natural Remedies, because it goes into additional remedies for allergies that can also be really helpful if you're suffering from sinusitis from allergies. Okay, thank you for tuning in to the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure you subscribe, please. And also, please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. We'll see you next time on another episode of the Invite Health podcast. And thank you so much for listening.